Welcome. We're here today with Dr. Olsen,
Hi, Denise.
our expert on headaches. And we are going to talk about headaches, a very common problem that people have. And Dr. Olsen is going to talk to us about that.
Thanks, Denise. It's great to be here today. Today we're going to talk about headaches. And one of the things about headaches is, today, for example, is about headaches and stress. So, Denise, you've probably, maybe either yourself or known people who have gotten stressed, and during the course of that process of being stressed, get a headache or develop a series of headaches or suffer headaches on a frequent basis because of stress.
Yes.
So many people want to know, how does stress cause headaches and what do you do about it? So, Denise, one of the things that happens is when people have chronic stress, it actually affects, as you may have experienced or know people who have, tightens up the muscles. Okay?
Right.
And very simply in the spine, in this area here, there's muscles and ligaments and tendons, and when there's tightening like that, it basically creates what's called trigger points. We call it myofascial pain and dysfunction, and those trigger points can refer pain right up into this head and neck area. Okay?
Thus causing a headache.
And thus causing headaches. And so stress also affects our blood supply. So
important blood supply.
yes, well, it's all over the body, but commonly that headache is the area where it's felt at. But what happens is with stress, the blood vessels constrict. It affects the blood vessels in the muscles. It also affects the blood vessels to the head area. Sometimes people get it to the extent where they may have migraine type headaches, but stress type headaches very commonly have that component as well, where they don't go to that extent.
So if someone's experiencing a headache, what would be something that you would do if they came in and said, I have a chronic headache? What would be something that you, as the expert of headaches, what would you do?
You know, what I've found to be the most important part of it is finding out the cause. It's what we call finding the root cause of a problem. Many times people will treat it with a Band-Aid, and that's either
An aspirin.
An aspirin or an ibuprofen. Do things to treat the pain. And obviously you need to be comfortable, so you need to be able to get rid of the pain. But more importantly, if it's occurring on a regular basis, is to find out that root cause. Why is it happening?
So instead of continue to mask the pain, you want to get to what is causing the pain.
Correct. And in the process of helping people to get better, there's what I describe as two parts to it. One is typically if you've had stress in that capacity, usually there's a certain amount of damage that's happened to the body. So we need to find that damage, we need to fix that, and that's part of where I come in. The other part is getting rid of that stress or finding out ways of managing it better. And sometimes that could be a person in your life, it could be a situation in your life. Sometimes it's a physical stress, a job or a position or a repetitive activity that is that stress.
Traffic on the freeway.
Can be traffic on the freeway, exactly. So most important is for my part is to talk sometimes in extensive detail with the person about what's happening in their life, where are those details at. It might be how they're sleeping, it might be that position they're working at, it might be the stress at work, it could be stress at home. Identifying those and seeing again what the damage is, and then what needs to be done as far as life-wise to get rid of those, or modify them, or change the way that you respond to them.
So let's say someone is interested. How would they go about coming to see you?
Well, the best way to get started is to call the office, and they can get scheduled for a consultation. The number at the office is 949-859-5192. We have a lot of great information on our website as well. That's AskDrOlsen.com, where you can find out more about our treatment approach and more about headaches and these causes and what we do about them.
Excellent. And so you've had a lot of good results with people feeling relief from their headaches.
Oh, absolutely. And not just relief, because sometimes relief is easy to come by, but actually relief and finding that cause.
So long term.
So long-term results. That's what my plan is for patients is if they've been having headaches for a period of time, is to identify these things we've talked about, so that they just don't get rid of the headache for today. They can know that their headaches are going to be gone, and know how to better manage things to keep them away.
Great. If someone wants to know more about you, they can go to AskDrOlsen.com.
Yep.
And then again, your phone number is 949-859-5192.
All right, great. Thanks for being with us today, and we'll catch you on the next video. Thank you. Bye bye.